Alison, you are live on Sweet Tea with Emily. Welcome.
Really live. We just started this.
Just started it. My poor guest. I always jump on like maybe a minute or two before we start, and here we are. So, all right, Alison, what can I get you to drink today?
Well, Emily, I am delighted with in honor of your podcast, with my cup of tea. But it's not just any tea. It is Barry's tea, blended in my hometown of Cork in Ireland, that my family sends to me or ships to me. And it's Barry's tea. If you know, you know. But if you know, you'd have to be Irish to know.
You're going to have to let me sip some of that.
I would be happy to share some of my precious contraband Irish tea with you.
I know, right? If it's special delivery, I'm all for it. I love it. Alison, I sat down the first time we met in person was last year at a coffee shop, and it was like instant friends. I was like, I'm not letting you get out of my sight, and here we are today. I'm so glad to have you on.
Thank you for saying that, Emily. I enjoyed our chat too, and it didn't feel like it was our first chat.
No, you were actually a speaker at an event. And you said something that was very captivating. I think I even made you a cape.
Like
printing it in. I'm going to have you do an intro, but before I do that, do you remember what you said?
It was a BioHive WITS event, and WITS stands for Women in Tech and Science, or Women in Technology and Science, which is a community that we're building through the BioHive organization here in Utah. And I said, we picked WITS as opposed to Women in STEM. We picked WITS because it lended itself to using it like keep your wits about you, rely on your wits, using your wits. And so I think you were amused by that phrase, and you gifted me this beautiful embroidered cape with "Keep Your Wits About You" on it, and it's hanging here in my office, and I love it. Thank you.
Oh, well, I was so inspired when you were talking. I think the entire room was just about really elevating the community and remembering, maybe it's not as hard as we're making it if we kind of stick together and move forward on things is the main message I remember.
Yeah. And if it's not there, build it.
That's right. That's right. Alison, we know you're a builder. For those that are going to listen to this that have not met you, tell us more about Alison.
What a generous question. And again, I'll point out, being Irish, this answer could go on forever, but I'll be restrained. I think I would define myself very pithily as an Irish scientist living and working in Utah. And I sort of bookend that description with location, exactly to refer to what we're just talking about. My family, my work are really important to me, but so is where I am with those. And, the first half of my life was spent in Ireland. I was born there, and all my family and friends and community is still there and still very alive and active. And that's an important context for me. And then on the back end of that, I'm living and working in Salt Lake City. And that also means that my family, friends, and community here is also very important. And the community here relates largely to my work. So as a scientist, I work at Seek Labs. And we are a life sciences company focused on developing diagnostics and therapeutics to improve global health. And so where I work and how I work is impacted by community, friends, family, as well as what I'm trying to achieve. So that's how I would describe myself. That's how I feel about myself.
There's so many things that I can relate to you. And I feel like the older I get and the longer I'm in Utah, the more I appreciate my Southern roots, where I came from. Remembering those foundations actually helps me be more grounded of where I'm at today and where I'm going. And so that's so relatable to me. And I talk a lot about my Tennessee heritage in Higher Integrated. And, there was just a lot of different people I grew up around, but I will say at the core of what I did learn was hospitality, making people feel welcome, offering them a drink, like there's just something about getting over those barriers quickly as we kind of bonded together as a community that I felt like could really be manifested in a company. So it's so relatable to me in my job. How has being Irish helped you be successful in your job?
I've never thought about that before. I was Irish. That was it. Or I am Irish. Although I've recently become an American citizen, so I'm proud of that too.
Woo! Congratulations! Not an easy thing to do, I would imagine.
It turned out to be a lot easier than I thought. And
really?
So, yeah,
just because you had been here so long and already working, or what? Why?
Been here so long, and also it's all online now. So sort of maybe one of the benefits of COVID is that these applications and systems have moved online, and so for those of you who've applied for TSA or global entry, the citizenship didn't feel that much different.
Oh, good.
Yeah.
Good.
So I think, irrespective of where you're from, Ireland, Tennessee, in your case, I think it's that we're a product of not only our genes, which is very important to me as a scientist, our genes are the source of our ground truth, but also our environment. And I think you spoke to your legacy, from your environment in Tennessee was hospitality. And I think I would sort of double down on that. And it's in the sense of, it's about making connections. It's about partnering with people, family, friends, colleagues, peers, and so forth, and sort of knowing that working together is always going to be more successful, more rewarding, more impactful, more meaningful than working in a silo. And I've always thought, silos are sort of the enemy of productivity. And in science, it's built on a spirit of collaboration. And so I think that ability to be authentic with people, you can't be authentic if you're isolated.
That's right.
Authentic is reflected back to you. And so where you're from and how that background environment or ecosystem has cultivated how you interact with the world and the people that you're collaborating with or partnering with, or just having a transient interaction. You're standing behind somebody at a line in Costco, and if anybody's ever been to Ireland, they'll recognize that when I say that we love to talk to anybody. If you happen to be standing next to somebody in line or sitting next to them on a bus or whatever, there's an unspoken invitation to chat. Just and I think it's making that connection. And in a way, when you said sort of this was important too, maybe in our history, the kind of structure of having clans and tribes was instrumental to our very survival. Maybe that's what's imprinted on the need to make these connections and community.
It's so funny. I will say that's probably the one thing, the longer I'm here in Utah, not as much small chat, in the grocery store, at the gas station, and I have definitely gotten out of the habit of that. Like almost to the point when I'm back in the southern states and I am checking out the grocery store and someone's asking me a lot of questions, I'm like, wow, that person's really nosy. And I'm like, Emily, no, this is not. This is not. They're not nosy. Like, don't be that much of a Westerner that you forget that this is just. Well, Alison, I mean, you are really well thought of in the community. Congratulations on your recent award, the 30 Women to Watch. Like, such an impressive group this year. Like, and you are so happy to see you on the list. I mean,
I'm flattered to be in that company, and all credit to my colleagues and leaders at Seek Labs, Jared Bauer and Bridget Baldwin for nominating me. It was so meaningful, and yeah, I'm thrilled and privileged to be just in the company of those women.
oh, you belonged. That was where I would hope to have seen your name and face. So congratulations for getting the recognition that I feel like you truly deserve. What are you working on? I am not in the everyday world of STEM, and you are just at the epicenter of it. Tell me what is happening in your world.
Okay, so I'm going to give a little bit of a backstory. So I'm an immunologist by training. I did my PhD in immunology at University College Cork in Ireland. And I had the good fortune of training under an oncology surgeon, Professor Jerry O'Sullivan, who literally would come from the surgical theater up to the lab and would tell us about, you know, what his day was, the patients he was operating on, and the challenges he was seeing. So from the very early part of my training, from undergraduate projects almost, I was aware that I might be working in a lab, but the science that we were doing had a direct connection to somebody's mother, father, sister, brother, child. You know, he inserted the patient into my scientific research, and it's never left. And that's sort of, even though I've worked in different aspects of the life sciences, I've never lost sight of the fact that we're doing what we do to help patients and improve their lives and the lives of their family and their community, right? This is why we do it. And so having received my PhD in Ireland, I came to California first to UC Davis, and then to the Gladstone Institute for Virology and Immunology in San Francisco. And then I left academia. I was an investigator at the Gladstone for a couple of years, and then left academia to go into industry and worked to build systems that could be used to test chemicals and antibodies to see if they had a viable path to becoming a drug. So I was involved in drug discovery through providing technologies, tools, services to support clients' work. And then in 2021, came here to Salt Lake City, initially working at Recursion in drug discovery, and now working at Seek Labs. And as I may have referred to already, but Seek Labs' mission aligns, you know, in many dimensions and 100% with, I suppose, the mission that I hadn't maybe articulated so early in my career, but it is really to improve global health. And at Seek, we believe that means that every patient has the right to an accurate and timely diagnosis and a safe and effective treatment. And one without the other is not good, or is in fact almost cruel. Could you imagine having a diagnosis with no treatment?
Yeah.
Then, or sort of being administered a treatment that didn't match your diagnosis. And these are lives at stake here. So I love that approach, that we're going to improve global health through better diagnostics and better therapeutics. So my team within Seek Labs is the pharma division. So we're on the therapeutic side, and we're looking at how naturally occurring, what I like to call molecular scissors. So these are enzymes that literally cut DNA or RNA, how they can be leveraged or exploited or used, whatever your verb is, to combat infectious disease like viral pathogens. Every single person on the planet knows what a viral pathogen outbreak is. We just survived one a couple of years ago. And also oncology indications, because they remain really just a complete challenge in so many countries for so many individuals. So using these molecular scissors, Seek Labs is innovating technologies to improve patients' outcomes.
I am so glad smart people like you are in this field. I mean, really. Um, so close to home. I won't go off on any
No,
details.
no, but this is what it's important for me to hear as well. Like, this is not a computer program. This is not an algorithm. This is not a cellular assay. This is cumulative work of many, many people, many, many more smarter people than I, but why we do it, the purpose of what we do. So please share your story, Emily.
Oh, I'll try. I'll try to give you the short, non-emotional version. But yeah, no, I mean, my dad had a genetic, hereditary, disease. As amyloidosis was
Yes.
what it was. And it's kind of becoming more known, but this is a very recent, topic that's really been discussed in the community, but the misdiagnosis, and I remember when at first, you know a lot more about this than I do, but basically an excessive protein that attacks organs. And it at first attacked his heart. And so his heart was just slowing down. And I remember that open heart surgery, 5, 6 years ago. And the surgeon told my mom right afterwards, it looks like a virus attacked my dad's heart. And oh, how I wish they would have just taken a sample of that and tested it, but they didn't, right? And then it goes from another part of his body to another part of his body. And he's just like shutting down, he's declining and something's wrong. And so many misdiagnoses, so many, And I mean, Alison, we were a couple of years into it until they did DNA testing and looked at everything. And that's how we got the amyloidosis. And that was because my mom demanded it after research on her own.
I remember years ago, again, back in Ireland, but I think it might have been the same here, maybe a generational thing. You would never question a doctor. It would be appalling for you to go to your doctor and say, I want another diagnosis, or I want another check. My parents would have considered that to be rude. You just accept it. And patients have an enormous amount of power to advocate for them and their family members. And I hope that your message would resonate with those to give them the courage and the motivation to advocate.
Yeah. I mean, my mom's a godsend because it is hereditary. There's, there, it doesn't mean that it's 100%, but every child's 50-50. And so to be aware of it, the clinical trial has been successful. It's now the drug is on the market. So it doesn't get rid of the disease, but it sure does slow it down tremendously where someone can live a really great, healthy, long-term life if they stay ahead of it. So you're right. Diagnosis can save lives, and timely diagnosis can continue to save lives, right?
And effective therapies, effective treatments. And I think what excites me the most, Emily, is that we're in a new industrial era, a new, we had all of these advancements. The steam locomotive was a transformational event. I think we're in the era now where compute power, artificial intelligence, machine learning, large language models, all of these tools, technologies, capabilities can finally enable us to get our hands and heads around the scale and scope of data that exists on research projects, on patient data, on population data. We've spent the last, century gathering data on this. We're gathering that data in a decision-making way only. Is it active? Yes, here you go. Is it inactive? Is it dead? Is it toxic? Here you go. And negative data was archived away. Now all data is usable. All data is the source of learning and knowledge, and machines can handle the scope of it and the scale of it. And so I think we are going to see rapidly the wins from connecting data, making sense of data, allowing machines to use algorithms to recognize patterns and signatures and relationships in a way that our human brains, bless them, they've been good, but they just could not cope with the sheer scale and speed that's needed. And so I feel like we're at sort of the dawn of the new era of, data driven advances in life sciences and in drug discovery and in managing patients' health. Again, we want people to live well, whether that's curative or managing the disease. The goal is to allow people to, getting back to the very first, enjoy where they are, live, enjoy.
Making connections and having memorable, meaningful moments of life.
Exactly.
No, like I said, I'm not in STEM. I
think we're all in STEM.
We are, right? Like I've recruited for it. I've got friends in it. I've got hiring managers, a little bit of brushing the surface. But
I actually sort of mean that more seriously than I sounded. I do think we're all in STEM. I think we're users, we're builders, we're part of the community. We have needs of STEM. We have contributions to STEM. I feel like that science and medicine, maybe we've put up barriers to folks that have sort of getting back to siloed ourselves away that maybe hasn't served us well. And I think, we also saw a backlash to scientific advancements during the whole COVID that was driven by a lot of misinformation. And I think, we really should acknowledge that we are all in some way connected to STEM. We're all using it.
Let that be our takeaway. Set aside your intimidations. Be eyes wide open and kind of see your connection and impact that we all have to it. It's hard because, Alison, you're just at the Epic Center and you're such a giant in that community, and it's everything that you breathe. So harder said than done, but definitely a challenge. I could talk to you for hours. Actually, I could talk to all of my guests for hours.
Thank you.
Yeah, it's a problem because there's nothing succinct about me and my interview style and my genuine interest for continuing this, but we will, just not live, hopefully in the very near future. I do want to go into lightning round for those that have stuck around here at this 23-minute mark. So I do have 4 questions. They're not going to be a surprise, so we can kind of get through them. We talked a lot about Ireland. I don't know your answers to any of these, so I'm genuinely interested. What would you bring besides tea, of course, here with you? Like, what do you want that's still at home to bring with you today?
I'm going to say brown soda bread. So if I can have my tea. Costco sells Kerrygold Irish butter. So if I could get brown soda bread, I'd be set.
Is it sweet?
No, it's a little like rye, but better. So sorry, no apologies to rye lovers. But.
Everyone's turning into sourdough. If you're American, it's the sourdough trend.
It's not sourdough. It's sort of a very rich, dense, grainy, super tasty, salty, Irish brown soda bread.
Oh, and put some butter on that. Yum, yum, yum. Okay. In your 30 Women to Watch, you gave advice to your younger self. Will you tell us what that advice is?
Yeah, younger self. And I would say to women in STEM, particularly here in Utah, is my plea, my call to action is that you are where you need to be and where we need you to be. You have contributions to make in STEM. You are valued. We need you to be visible. We need you to be vocal. We need to value you more, promote you, give you opportunities. You deserve the seat at the table. And if it's not there, bring a deck chair.
Oh my gosh, I love you. Okay, what's your guilty pleasure, Allison?
Um, I I love seeing order out of chaos. Sort of my I haven't been diagnosed with OCD, but I'm pretty sure I have aspects of it. And so I don't know if you agree with me. You watch the news these days, and the world feels like chaos. So I like to go from the news hour on PBS, to watch home decorating shows. People can take an awful kitchen or an awful bathroom and make it pretty in an hour.
Yeah,
That literally settles my soul. It's like, oh
good.
my God. And things that give me joy now are things like, oh, it's not a load bearing wall. And yes, we can replace the.
I do have a philosophy that, like, that is a trend I have found almost in every aspect. Whatever I have or I'm involved in, I try to just make it better. I'm not saying I can make it perfect or
Yeah.
better than someone else,
Oh,
but
that's
I at least try to find a way to improve it however I can.
that's
And
a lovely philosophy and modus operandi. I'm gonna adopt that wherever and however I can as well.
well, when we did meet at that coffee shop, you always told, I think it was your son, you had a family philosophy, and it was, um, be healthy. What was
Be
we
kind.
be kind, and there was something else like be kind and healthy, right? Or what was it?
You know, my wishes for my son when he was born is that, you know, he'd be happy, healthy, and kind.
Happy, healthy, and kind. That's right. Happy, healthy, and kind. And speaking of your son, what are you most proud of?
Um, oh my God, that's going to set us over time. But I will just summarize by saying it's a privilege to be his mother, because I love him as my son, but I like the man he's become. And you know, he's hardworking, he's smart, he's kind, he's funny. He values community, he values connection. His dad and I are so proud of him. It's the best work we've done.
Oh, well, Allison, he has one hell of a mother. So you you get to take credit, and you should, and you own it, and you make sure that he always remembers that, as it sounds like he will. But Allison, I'm so grateful for you to be my guest. Thank you so much. And you and I are going to get together really soon, hopefully, if I can get on your calendar.
You can get on. I'd love to have you come round and have a cup of Barry's Irish tea.
Deal. Thanks, Allison.
Emily, thanks. I wish you the very best.
Thank you.